At this hospital in occupied East Jerusalem, an improvised new ward has been set up. 16 beds readied to isolate patients who test positive for coronavirus. Already 3 patients who have tested positive have been sent to hospitals in West Jerusalem after an infected man from a nearby neighbourhood visited his elderly father here. The hospital director says the Israeli government has failed to help prepare East Jerusalem's health system to tackle the pandemic. Not enough protective equipment, only 23 ventilators between 3 hospitals serving 350,000 people.
This is too little. I mean, this is why we urge our people, our population in East Jerusalem, please stay at home, because, you know, if the real serious outbreak goes out of control, there is nothing we can do. There is so little we can do.
The Israeli Health Ministry has said COVID-19 patients from East Jerusalem could be treated in the west of the city and that a major outbreak isn't expected. But in recent days, cases here have started to spike, despite attempts by local committees to enforce lockdown measures.
The Israeli occupation was not happy with this, and they clashed with the groups. I think Israel must understand that we, all humanity, are in a war against corona, and it is not the time for issues like who is sovereign here.
Jerusalem has the highest coronavirus numbers of any city on the Israeli Health Ministry's list. It's been reported that ultra-Orthodox Jewish neighbourhoods account for about 3/4 of them. Israeli officials say Palestinians have largely abided by the lockdown restrictions. They may also have been protected by a younger average age and fewer contacts with people who've been overseas. But there's also been a lag of some weeks between testing facilities being set up in Jewish areas and in Palestinian ones. More and more testing centres like this one are opening up for residents of occupied East Jerusalem, but the concern is that the delay is still preventing health authorities from getting an accurate picture of just how widespread this disease is. Palestinian-Israeli politician AHMED TIBI has demanded greater testing capacity. Now he's calling on Palestinians to use it, putting aside any worries about social stigma.
We as a leadership, doctors, physicians, health ministry, in order to convince people that it is wrong not to be tested, it is right to go and to be tested for the sake of yourself and your community.
This week, the Israeli government committed to provide testing for 150,000 Palestinians living in parts of East Jerusalem cut off by the separation wall after a court petition by a Palestinian-Israeli rights group. More densely packed communities where the scale of the spread has been, so far, unknown. Harry Fawcett, Al Jazeera, occupied East Jerusalem.